Hello, we are Ömer and Sena, and our project is inverse grading. Inverse grading is a technique used in many areas of medical imaging. In this project, we have demonstrated inverse grading for 5 different trajectories and 4 real MRI images. In MRI, sometimes non-Cartesian acquisition trajectories are used. These trajectories can have advantages of their own. For example, using spiral-shaped trajectories gives quicker acquisition, which can be very useful for fMRI. However, the traditional Fourier transform is built for Cartesian grids, so we need methods like grading and inverse grading to reconstruct images. To test our inverse grading, we generated our own non-Cartesian trajectories. We used inverse grading and then regraded them to see the difference from original image. We also graded and inverse graded the image back and forth multiple times to see the effect this would have. We used open fMRI's working memory in healthy and schizophrenic individuals dataset. This dataset was used in a study focusing on the functional connectivity of individuals with schizophrenia when they are doing cognitive tasks. We used 4 patients' anatomical brain MRI images as test data for this project. The following are the trajectories we generated. We used the parametric equations of these trajectories. The user can modify some of the parameters optionally. We use Voronoi method to calculate the weight of each non-Cartesian data point. However, since the Voronoi method returns unreasonably big for the radial outermost data points, we bounded the original data using a frame. In our demonstrations, we used a circular frame for spiral, radial, and rose trajectories, and a rectangular frame for the Lissajous and wave trajectories.
We have implemented an inverse grading function. We begin with Cartesian k data. First of all, we find the image corresponding to this k data in order to do preemphasis. We can do preemphasis by dividing the image by a transform of the inverse grading kernel. The next step is to convolve the k data of the preemphasized image with the inverse grading kernel. After doing this, we sample this data onto a non-Cartesian trajectory. The image size parameter given to the function for the demonstration was 80, and the oversampling factor was 2. The kernel width was also 2. We calculated the error using 5 different error metrics. They're listed here. Our first analysis was testing all 4 patients' images for each generated trajectory. For a single trajectory, we inverse graded all the patients' images and regraded them. The error images were calculated using normalized MSE. Here are the spiral trajectory results. Since the spiral trajectory samples largely from the center of k-space, the resulting images are almost identical to the original image. Here are polar trajectories results. Polar trajectory samples densely from the center of k-space as well, so the performance is very good. The Lissajous trajectory samples the edge of k-space a lot more densely than it samples the center. Therefore, it is not the best trajectory to use for MRI. This result shows a lot of aliasing. The rose trajectory samples the center of k-space, but not as densely as spiral or polar trajectories. Therefore, the results are better than Lissajous, but not as good as spiral. The waves trajectory distributes data points more uniformly than the other trajectories we have tested. It does not have a preference for the center of k-space. There is slight aliasing toward the edges of the images. Our second analysis involved taking the data of one of the patients and doing inverse grading and grading back and forth 5 times. This allowed us to see the distortion caused by the grading and inverse grading operations. The resulting image of the spiral trajectory through 5 iterations is shown here. The performance seems to be very well until the 3rd iteration, where the darkening around the edges seems to be getting profound. The resulting image of the polar trajectory through 5 iterations is shown here. The performance is similar to the performance of spiral trajectory. The Lissajous trajectory results are shown here. The first iteration is already not very promising. The aliasing artifacts continue to build up with each iteration, and with the 5th iteration, the image is already unrecognizable. And here's the result of the rose trajectory. After the first 2 iterations, the results seem very problematic. The aliases coming in from the edges of the image cause a lot of distortion with each iteration. The resulting image of the waves trajectory through 5 iterations is shown here. After the first 3 iterations, there is significant darkening around the edges of the image, and there is also aliasing. The grading and inverse grading operations do not give perfect results, and the magnitude of the errors greatly depend on which non-Cartesian trajectory is used. The reason is that grading and inverse grading are not perfectly inverse operations, they're both erroneous. While grading, we smear the data on the non-Cartesian trajectory and sample from this. While doing inverse grading, it is impossible for us to gather the previous information from the smeared data. Also, for MRI imaging, some trajectories are better than others. Ones that sample the center of K-space very densely, such as the spiral and polar trajectories, have very high performance. The others that do not sample the center of K-space densely, especially the Saju, do not perform very well. The error that accumulates after iterating back and forth between grading and inverse grading can prove to be very fatal for some non-Cartesian reconstruction techniques, such as non-Cartesian spirit. The POX approach of non-Cartesian spirit does calibration consistency in the Cartesian domain and data consistency in the non-Cartesian domain. Therefore, it requires doing grading and inverse grading in each iteration. If these operations are very erroneous, then the result may not be a meaningful image. Thank you for listening.